Unfortunately, at this point, I would have a hard time saying, both myself, other gastroenterologists and researchers, that we don't have a perfect and complete understanding. What we can tell you is that you haven't done something wrong. It's not a result of only being urban versus rural versus being born in a certain place. It's not because they had too much Halloween candy. But it does have something to do with the type of immune system that reacts. It's almost over responsive, and there is some link into some of these allergens or atopic backgrounds that we talked about. But what we do know is this: we're more aware of it now compared to 20 years ago, but we are seeing an absolute increase in the number of cases, particularly at this center, and it seems reflective across Canada as well. So we don't think of this as a congenital condition, which means you're born with it. But, it's sometimes hard to know how early it can start, as we do have patients presenting as infants, even under the age of 1. We often are resistant or not very keen to do scopes in very early in months. And there is a fair amount of overlap between fussy feeders, colicky babies, reflux, cow's milk protein sensitivity that can seem a lot and overlap with EoE. And some of those you do outgrow. So it often does take us some time longer to kind of figure out that it is that related diagnosis. But certainly if there is poor growth, as mentioned earlier, that's something that may help us trigger into it. If it was purely a congenital thing, it would all present early, but we have patients presenting more often in older childhood, teenage years, and even some people, of course, as adults, who tend to have a longer time before they get their diagnosis figured out.